Good evening once again, postgraduate students of the University of Adelaide, JBI collaborators. Welcome to this fourth presentation in our JBI Postgraduate Research Degrees 6-part webinar series. My name's Alex Mignoni, Program Coordinator for High Degrees within JBI, and it's a pleasure to be here again and help facilitate this evening's presentation, our fourth presentation in the series. Now, given it is our fourth presentation in this series and so many of you have been logging in at the same time each week, our JBI HDR committee just want to acknowledge and thank you for your continued participation. Obviously, you're enjoying it. You continue to log in each week. So we thank you for that. We hope you're getting something meaningful out of the sessions. Now, this presentation is a particularly important one to us. We're fortunate to welcome back a former student of the JBI program, and it's great to see that in addition to our current cohort, we've got many of our former students that have logged in and want to be part of this very special presentation this evening and check in and see what our presenter's been doing since she was last with the program, or since she's completed the program. As we do at the beginning of all our webinars, we must pay our respects to those native to this land we gather on. And we're coming to you live from JBI headquarters within the University of Adelaide. And we acknowledge and pay our respects to the Kaurna people, the traditional custodians of this land. We acknowledge the deep feelings of attachment and relationship the Kaurna people have to country, and we respect and value their past, present, and ongoing connection to the land and their cultural beliefs. Now, I'm obliged to tell you that we are recording this session, and an edited version of the session will be made available on the JBI YouTube channel. So all registered participants will have the opportunity to see it when we upload it to the JBI YouTube channel. Now, all participants are logged in via a listen-only mode, so we can't see or hear from you, but you can interact with us. We have a chat function that you can chat amongst yourselves, or you can chat with us. But if you have something you want to put to our speaker, a particular question, I'd encourage you to use the question and answer functionality. Now, before we get into this evening's presentation, a very special, significant event I want to highlight to you. It's the JBI initiative. It's the World Evidence-Based Healthcare Day. Now, launched just a few weeks ago, this event is already building incredible momentum internationally. It will be an annual event held on the 20th of October. And the purpose of the occasion is to raise awareness of the need for the best quality evidence to inform healthcare policy, and to acknowledge and celebrate those researchers, educators, and health professionals, policymakers who continually strive to improve health outcomes globally through the synthesis, transfer, and implementation of the best evidence into practice. Now, it's fitting that we have some former students with us this evening, because what we'd like to do is invite current and former students to submit an impact story to us. So across the JBI collaboration and all of our HDR students, we'd invite you to submit a story, perhaps your own experience of where you've used evidence-based practice, or you can highlight for us. Now, it doesn't need to be a lengthy story or complex. You can submit a few lines to us, give us an example of work you've been doing in evidence-based practice, how you feel that you've contributed to impacting health research or policy or practice, perhaps guidelines in your workplace, and even patient outcomes. You can detail the positive outcomes, but you can also let us know what challenges you may have faced, what you've learned from the experience, and what you might recommend for the future of evidence-based practice. So I encourage you to do that. You can either get onto the website and submit it that way, or you can submit it to me by email, or you can contact us via the HDR social media. Now, I'd like to introduce our host for this evening. She's a research fellow within the JBI Implementation Science team. She's the field editor for cancer, burns, and midwifery for the JBI Evidence-Based Practice Database. It's a pleasure to introduce another one of my colleagues, Dr. Ashley Whitehorn.
Thanks, Alex, and thank you everyone for joining us tonight with Megan. So Megan is an orthopaedic surgery trainee from Adelaide, but she's currently working in New South Wales. She completed a Masters of Clinical Science with JBI in 2018, and for that she received the JBI Student Award for Academic Excellence. Now, I didn't have the pleasure of meeting Megan while she was studying at JBI, but our paths have crossed through netball in Adelaide, as Megan is a rather talented netball player. Now, without any further delay, it is my pleasure to introduce Megan Cain to talk about how she is applying what she learned in her Masters to clinical practice tonight.
So thank you for having me talk tonight. So I'm Megan, as previously introduced, and I've been asked to give a short presentation on applying systematic review evidence to practice. So the application to practice whilst preparing, conducting, and having completed a review. So what are some of the key considerations? So as briefly touched on, so I'm born in South Australia and undertook all of my education there, but I'm currently working as an orthopaedic surgical trainee in New South Wales. I have a goal that on completion of training, I'll specialise as a paediatric orthopaedic surgeon, working predominantly in a public hospital multidisciplinary team. So I completed my master's through the Joanna Briggs Institute in 2018, whereby I undertook a review looking at the effectiveness of different minimally invasive epiphysiodesis techniques in correcting a paediatric leg length discrepancy. So essentially, I compared different methods in which to stop the growth of a longer leg, so as to reduce the leg difference in children once they were of skeletal maturity. So just like each of you, I'm sure your topic was synthesized based on an area of interest or a topic that you had previous exposure to or felt was lacking evidence to support what yourself or colleagues were doing. For me, the idea was sparked after a really simple discussion with a consultant at the time about an upcoming case whereby the orthopaedic department was split in the best way to manage the condition. At the time in Australia, the most common technique was something called percutaneous drilling and curettage, like seen up here at the top. Whilst in Europe, they were more likely to fuse the physis with screws. On a quick, though in hindsight, not thorough enough review of the literature at the time, we were unable to find any substantial evidence to guide management. And thus, like many surgical interventions, management was purely guided on surgeon preference. So for me, this conversation happened around a time I was exploring the options of doing a master's so as to better my chances of obtaining an orthopaedic training job. And I was lucky enough to hear about the Joanna Briggs Institute master's program through colleagues, and essentially the rest is history. So as you're all partway through or have completed your master's by now, I'm sure you've realised what an important tool critical appraisal is and how poorly it's done in the wider community. I know that I was pretty average at it prior to undertaking my JBI master's. Well, to me, it was one of the most valuable things to take from my Joanna Briggs experience. And I urge you not to stop the process with just one project or one question, and to continue questioning things into the future. Unfortunately for me, since finishing my master's, life has kind of flown past and I haven't actually finalised my publications for my master's thesis. But there are a number of other ways that I continue to implement the skills I learned through the Joanna Briggs Master's program, and particularly focusing on critical appraisal. So for me, I have since commenced a PhD through the University of Amsterdam, where I'm looking at the incidence, complications and reasons for tibial malrotation following intramedullary nailing. I now undertake regular literature reviews to try and aid in the management of complex patients. So trying to determine preoperatively what are the known complication profiles so you can appropriately consent a patient. Are there other considerations that need to be made? And usually these papers are small case series, though you can still learn from their experiences and try and guide your management accordingly. I have also started regularly surveying the literature for new techniques, so how we can personally improve what we're currently doing in our state hospitals. We're really lucky that the Royal Australian College of Surgeons and the Australian Orthopaedic Association are both very active in keeping us informed of new research, and they have monthly newsletters that go out with links, so that makes it a little bit easier for us. Another thing, very orthopaedic specific, but I've taken a lot more interest in our National Joint Registry results and have started, questioning consultants and, trying to adjust practice according to these results. So this registry is one that was set up in South Australia and is now a national registry which collects data on every surgeon undertaking a joint replacement operation. And they collect information such as patient factors like age and diagnosis, implant factors and more. And these results are then published yearly, which allow for poorly performing implants to be flagged and actually removed from the market. But it also flags surgeons that might be a little bit outside the expected bell curve, and can suggest that they change their current practices. But it also detects high-risk patient characteristics. So maybe we need to do something more to make them safer throughout their procedure. And finally, I try and use the critical appraisal when undertaking morbidity and mortality audits. So I used to hate sitting through these meetings where you just got told what all of the complications were, whereas now you can, supplement all of your complications with the research. So why did this happen? Is this a common trend, or does it fit with population reported data? So that's just a short way of how I've implemented the skills I learnt into kind of my day-to-day life. Looking at my PhD a little bit more specifically, I've been able to use all different aspects of what I learnt from the master's program, given my PhD is one via publication. So I have to publish 6 papers on a topic that tell a story. And so I started by writing a systematic review as an opening chapter that looks at how tibial nails have changed through the ages. So looking at their changes, the complication profiles and more. I then undertook a validation study that was to ensure our CT measurement technique was appropriate and accurate enough to be used for the rest of our studies that we undertook. I put together a large database and have commenced multiple cohort studies looking at different aspects of patient treatment and outcomes. And along the way, trying to reduce bias, ensure statistical soundness, and of course, clinical relevance. Finally, I'm trying to bring all these papers together with a clinical study looking at the functional impact of tibial malrotation. Though this has been much harder than all of my previous imaging-based studies, as patients are consistently lost to follow-up and you have to rely heavily on others. So I'm by no means recommending everyone go out and undertake a PhD, though I do recommend that everyone try and use at least some of the acquired skills in their day-to-day life. And this process does not necessarily need to be time-consuming. You do not need to publish your results, though it does help the wider community if you can, but it will help with the management of your patients, clients, and more. So for me, when I have a question these days, the process involves a scoping review, and I usually start with PubMed, as from a medical point of view, it's a great literature source. And my path is then really determined by the number of hits that I have. So on a topic that appears to have a lot of information, I narrow down to high-level evidence such as randomized control trials immediately, and will then critically appraise as appropriate, so assessing the study characteristics, patients, and obvious bias. When there are contradictory results, that's when I will start branching out to other search engines to try and see if this is something within the topic itself, or is it more just I've got a biased view of publications because of what's in PubMed. I've always been one to work in tables, and I'll go through this in a minute, but I find it aids with data extraction and synthesis along the way. And for me, it helps me see the bigger picture as you read through a series of articles, so you can pick up what some common trends or differences are in demographics, and have they all used the same statistical analysis, or is it really heterogeneous, or those sorts of things. On the other hand, in cases where there is really poor or sparse literature quality and quantity on initial search, I expand my search really early and I essentially assess all papers that appear relevant. And often in these situations, they're mainly case series or case studies, and even opinion pieces. And for me, tables are even more important here because it helps you find those keys and trends or flaws within the publications. So what do I include in my appraisal tables is probably looks fairly similar to your summary of included studies in your master's thesis. But what you can see is I have a column for study characteristics where I list the citation, study design. So I find this is really important, where it's done and the study period. So is this data up to date or really old? And then the duration of follow-up. So from a medical point of view, that's really important to see some of those longer term issues. A lot of the time they might say that there's no long-term issues, but they've only followed up for 2 years. That's not going to capture a lot of the long-term issues that we have in many of our orthopaedic procedures. Then looking at the inclusion exclusion criteria, and importantly the aim. It's actually quite interesting when you look at a lot of papers, they never answer their aim, but these papers get published and they've concluded something completely different that they were never looking to answer in the first place. Next is patient or participant characteristics and intervention characteristics. So depending on your study, for me, for my master's, the most important thing was the intervention that they had. It didn't necessarily matter if they were males or females. But another thing you might want to include in here is the distribution of males and females. Was it even or not? Did you expect it to be even? What is the average age? Because that might be important if one paper's got, you know, an average age of 30 and another one's got an average age of 80. Of course, you expect different outcomes. What were their outcome measures? And then what are some key results? I always put a little notes thing down the bottom because in medicine, there's so many different ways to measure the same thing. So what techniques have they been using? And, you know, is that comparable to the next study or not, essentially? So I guess for me, the hard work has always been those hard yards at the beginnings, the synthesis of, you know, reading papers, determining, you know, what are the key features, and then, you know, putting together my tables. And once I've done that, a lot of the data has kind of presented itself to you. So I'm not really going to focus on any of the data extraction and synthesis side of things, but more on where we go with publishing, because I know a lot of people find it a really daunting task, and I'm sure that during your master's itself, it's felt like a mammoth effort to complete your thesis. And I know we're not expecting you to complete another thesis every time you do a systematic review, but it's something that is good to become familiar with and comfortable with. So for me, once you've finished the review, the most important thing is to determine, well, what sort of study have you done? And usually you'll know this before you sit down to write your publication, but just really think about it so you can determine your audience. So have you done a systematic review, a scoping review? Is it an opinion piece, or are you really just doing your review to supplement your results, you know, for your introduction and discussion of a original research paper? And then selecting your audience. So every journal has a specific audience. If you want to get something across to nurses, you're not going to submit it to the Bone and Joint Journal of the US because they're not going to read it. Like, you need to pick your audience and early on so that you set your paper, you structure your paper the way that they need it to be. And finally, is it relevant? What is your message, and is it going to impact your target audience? So when you're writing a paper, I have always been taught to make it a question-driven paper because it's more likely to spark interest, it engages the reader, and it's usually a lot easier to interpret or understand because you're spelling out the answer. It's not the p-value is less than 0.05, it's this led to that. and it's much easier to understand. It doesn't necessarily, you can explain all of the statistics, but it's not statistically heavy from a reader's point of view. I always write my methods and results first, because to me, you have all of the information for your methods and results. It's what you've done, it's what you've found, and you can then fill in the wordy bits after. So starting with the introduction, I always try and split my introduction into 3 major sections. So you've got your first paragraph, which is your background as to why have you done what you've done, and the rationale behind it. So what are the controversies out there at the moment, and why is it that this paper is going to change anything? And then finally, you've got your study question. So it's therefore we asked. And that's kind of in that last paragraph is where you bring in your aims and your questions that you're going to be answering throughout the rest of the paper. And so moving on to the discussion as the last thing is really that first paragraph is a summary of the introduction. You have to talk about your limitations. It's not possible to have a perfect paper. And that could just be there was only one surgeon involved, or you've taken 6 years to do the study, so maybe things have changed over the time course that you've done it. It doesn't mean that the paper is not a valid paper, but you just have to make sure you list it. And then you have a paragraph for each question that you were asking. So that last paragraph in your introduction where you state what your study questions are, if you've got 3 study questions, you have 3 paragraphs answering them, and you compare your findings to previous findings and reasons why they're either the same or different. And finally, it's the conclusion, so the take-home message and what you're hoping the readers can adjust their practice for, or whatever you like. Finally, the abstract. For me, I don't spend too much time on the abstract. I think it kind of comes together at the end. It's really just capturing the essence of the paper in one page. So it's sitting down, taking those key sentences from the introduction, methods, but really the main statement they want is your conclusion. What have you found? And if it's interesting enough, they're going to read it. I know it's been really brief summary of, what I've taken from the Joanna Briggs Institute and how I've tried to implement it into my day-to-day life, but I hope there's been something interesting and helpful along the way. But thank you.
Okay, thank you, Megan. We have got some questions if you're happy to answer.
Sure.
Okay, so as a busy clinician, how do you find the time to search and critically appraise the literature to inform your practice, or do you just have to make it a priority?
I have always just tried to make it a bit more of a priority. We are lucky that we do get half a day a week that is kind of admin time. So I use that for my admin time. Essentially, we'll sit down and read some papers and try and critically appraise. We've also tried to make it a departmental thing that we do journal clubs regularly to try and get others involved in the critical appraisal of papers as well. So it doesn't necessarily always fall on me, but trying to, teach the juniors to be involved in the research side of thing as well.
Excellent. Okay, so what approach would you take if a senior consultant or consultants had strongly different views on what the review topic should be?
As in for a master's question?
Yeah, let's go with that.
Yeah. I think it's really important to do something that you're interested in and find out what it is that means that they've got concerns about your topic. It may be that there's recently been a review out there, or that they know that there's not much that you're going to find, and there's other areas that have, more high yield outcomes. But it also may be that they have ulterior motives as to why they don't want you to search something. Maybe they've been doing something that's a little bit out of left field. But I think if you sit down and talk to them and talk to your reasons through why you want to do it, I'm sure you would be able to find someone to support you through your research project if you had good reasons behind it. It's just being confident enough to ask others as well.
Thank you. Okay, can you speak to the timing of your enrolment and the value of enrolling when you did versus earlier or later?
I think I was really lucky with my timing for enrolment. I did this as a PGY 3, PGY 4, I think I started. So I'd finished my basic surgical science exam, and was really just had a clear path until I got on to orthopaedic training. And so it gave me time to focus on doing a master's. And the good thing about the JBI is it's a really structured environment that you can finish it as quickly or as slowly as you want, essentially. So I don't think it impacted my, application for orthopaedic training. I think if I'd done it later, I would have struggled to have any of the beneficial points for getting onto orthopaedics. And then there's also the juggling with learning the art of orthopaedics as well. So I think for me, I'd done enough time as a junior doctor and finding my feet that I then had some time to focus on research and improving my research skills before jumping into training.
So it's perfect timing for you then.
Yeah.
Okay, so it's great to hear that you've moved on to a PhD, but on the Masters, would you say that the Masters completion is a better learning experience than the papers? Or do you regret not publishing the Masters work as soon as possible?
I think the Masters program itself was much more beneficial than the papers. But I think it also showed me how important it is to be involved in research to improve the, body of research out there. I found in my master's project that there was very little good evidence on epiphysiodesis, and I think it really highlighted to me that surgeons don't do enough research. And so I don't want to be someone that just pumps out papers for the sake of pumping out papers, but I think if you have an interesting topic that is going to add to the literature out there, to definitely try and publish it. From that point of view, I do regret not publishing my master's, and I'm actually in the throes of undertaking a second search because, of course, it's out of date. So I'm in the throes of doing that, and I will get my master's stuff published. And I do wish that I'd done it earlier, but I think the learning experience on a whole was better.
Good to hear that you will have them published soon. Okay, on a slightly different note. So the critical appraisal table looks like a study characteristics table. So it's more descriptive than anything else, than sort of internal validity. So do you use any tools for critical appraisal, or is it just kind of in your head, or how do you actually assess the internal validity of the studies that you're looking at?
Yeah, if I've got concerns, so the JVI critical appraisal tools I still have saved on my home screen of my computer. And I do look, I feel these days when I'm reading papers, and because I'm not necessarily actively publishing these reviews, it's more for my personal benefit. I don't do it as a 100% of a formal process. It's more in my head. But anything that I publish 100%, I use the critical appraisal tools that JBI had previously provided to us. But I think the more papers you read, you kind of get a bit more of an understanding of the internal validity and the errors that are happening.
Yeah, I think the more you read, the more you kind of get an understanding of the problems that you get within the literature.
Yeah.
Okay, so you talked a little bit about getting junior doctors and other clinicians involved. Have you influenced clinicians' perspective on the value of systematic reviews compared to literature reviews?
Probably not as much as I would have hoped to, but I feel that they're becoming more comfortable reading papers. So I don't expect everyone to sit down and do a proper systematic review, but if they can read literature and kind of interpret what is a good paper and what isn't, that's one step in the right direction. And it has, for some of them, encouraged them to go on to do higher degrees and masters and those sorts of things. And if I'm able to do that, I'm happy, because I know we've all got a busy life that, you have to realize that some people don't have the time and energy or want to put anything into research. And so if I can just make them appreciate a good paper versus a bad paper, I'm happy.
Okay, that segues nicely into the next question. How are you managing a PhD in half a day a week?
I think I just have quite good time management. I've always been someone that if I sit down to do something, it will get done. And I've got a really good working environment with my PhD supervisors. So I've always been someone that if I sit down and do some work, I will send it off to my supervisor so that they can appraise it or put me in the right direction. So it is a team effort. So it's not trying to achieve a whole paper, in half a day a week. It's small sections that you're moving towards an end goal together. So I definitely have periods of time where I don't look at my PhD. I'm quite lucky that my PhD isn't with a really tight time frame, and that's actually one reason I did it through the University of Amsterdam, because technically it can take me 10 years. I do not want it to take 10 years, but it means that there isn't that time pressure. So if work is really busy, I can, have a 3-month hiatus where I don't open it, but I know that it's always there to come back to. The other thing I found really good by doing it by publication is you kind of get that positive reinforcement every paper that you publish. So I've got 4 of my papers already. So if I achieve something, you can have a little break and be like, yeah, all right, and then the next hurdle. So I think for me, it's really just time management and trying to have just like achievable little goals each week or each month to make it happen in the end.
That's a good plan. Okay, one final question. Post PhD, would you direct junior trainees to do systematic reviews and or participate in the JBI Clinical Masters Program?
I think the JBI Masters Program is a great program. I think it's a really well-structured program that not only teaches you good skills about, systematic reviews, it's kind of research in general and interpreting research. So I would have no issues with directing my juniors to do a JBI. To do systematic reviews in general, I think it takes a certain person to do systematic reviews, and I think there's all different sorts of research out there that I would be more encouraging my junior trainees to be involved in research. And if that to them is a clinical study, a radiographic study, a qualitative review, like they can do whatever, and I'm happy to support. I don't think it has to be a systematic review because they are time consuming, but they do add a lot to the literature. So yeah.
Excellent. Okay, so thank you very much for your time tonight, Megan, and I will hand back over to Alex.
Thanks, Ash, and thank you, Megan. I know you're extremely busy, and so it's a real pleasure to have you, and I appreciate your time. We all appreciate your time this evening and the value of the insight that you provided with some of the practical applications from the Masters of Clinical Science offered by JBI. So look, just a heads up on next week, we have a very special presentation. Kate Knock, Director of the Evidence and Practice Unit of the Queensland Centre for Evidence-Based Nursing and Midwifery, which is also a JBI Centre of Excellence. She'll be here at the same time next week, Thursday the 1st of October, to speak about pre-planning and conducting systematic reviews with an eye to implementation. And next week, we'll be welcoming back Associate Professor Craig Lockwood. He'll be hosting that session. So that's all from us. Thank you again for your attendance. We've got 2 more sessions to go. Please stay with us. And until then, all the best and stay safe. Bye for now.